All right, good afternoon, everyone. Are you everybody having a great time at the show? Wonderful. Welcome for sure. And today, by the way, I'm Kate Dillon. I'm one of the show organizers, and I really, of course, want you guys to have a wonderful time. But I'm also very proud that we've been able to attract such talented speakers to the show this year. And the one that's next up here is Dr. Diana Williams. She is a board-certified nurse practitioner and a functional medicine provider. She's highly accomplished with a distinguished background in nursing and functional medicine. She has a doctorate of nursing practice from Duke University, a Master of Science in Nursing from Western Carolina University, and a Bachelor of Science in Nursing from Lenore Ryan University. Plus, she even has a Bachelor of Science in Biology from North Greenville University. So, incredibly educated. We are so lucky to have her today to tell us a little bit about the brain-ovarian connection. And so, let's give Dr. Diana Williams a nice round of applause.
Good afternoon. See some familiar faces out there. That's exciting. So I am Diana Williams, family nurse practitioner. I own Strategic Wellness Center. I'm going to tell you a little bit more about my business in a second, but I wanted to bring this photo up to kind of show you, well, I want to kind of get you thinking. So there probably is something that you've been exposed to that just doesn't seem like it fits, right? Like a couple, a husband, a wife, or maybe a food that kind of people eat together that doesn't really go, right? My grandmother used to love bananas and Duke's mayo sandwiches. I thought that was the most bizarre connection ever. Like, those two things just don't seemingly go together, but it was her favorite thing to eat. So you can kind of see that the brain-ovarian axis doesn't naturally make sense as well. But the more and more you actually start to study and read into this and understand fully what's happening between the brain and the ovaries, these two girlfriends are the best of friends, right? So the discussion today is talking more about what this gut-ovarian axis looks like. I mean, the brain-ovarian axis, why it's so important, specifically for not only to improve your quality of life, but just to decrease outcome or improve outcomes, decreasing your risk of chronic conditions that affect women specifically. So again, I own Strategic Wellness Center. Within that umbrella of Strategic Wellness Center, we do functional integrative medicine. We also have a functional med spa. We do also have a fitness center and a scalp spa as well. I teach other providers on the side how to do BHRT. We do a lot of hormonal balancing in our practice, so I teach other people. I'm a mom of 3 and a wife. My husband's here today. Hey. And then I also have quite a bit of education. I just love school. So yes, there's a lot of school there and there's a lot of school debt, but that's why I'm working on a Sunday. But this is me. This is my journey. So I wasn't always into wellness. I was not always a healthy person myself. So this was me. This was roughly, I don't know, about 9 years ago, 8 years ago. Shortly after the birth of my second daughter, my entire system went haywire. So my skin was the only physical symptom that I had. The rest of them were silent symptoms that nobody could understand or nobody could actually see. But my skin was horrible, right? I mean, I was one of those people that couldn't leave the house because my skin was so bad. I was having to wear gloves before I could even walk into the room to see clients. I'd wear gloves at the grocery store. I've got pictures of me on the beach wearing gloves. My skin was that bad. Head to toe, and I suffered this way pretty severely for about 2 years. But there were silent symptoms that were outside of my skin that you couldn't actually see. Things like panic, depression, anxiety disorders. I also have digestive issues. My hair was falling out. There was so many other symptoms that I knew in my system were all interconnected. They all had a root cause. They all started around the same time. I knew that they were all connected. So that kind of led me on this journey to finding functional medicine because I was seeing, several doctors, wasn't getting any answers as to what was why my system was disrupted, and then it basically took me on my own journey to wellness, and that's why I started Strategic Wellness Center. So the brain-ovarian axis. So we do understand that hormones are the connection between the brain and the ovaries, right? We're going to talk more about that in just a moment. But these are your typical symptoms, if you will, that we can experience that are related to both the brain and the ovaries. So mood swings. Mood swings can be anywhere from anxiety, irritability. Most women experience this kind of through the perimenopausal period at the most severe time. They have a lot of depression, anxiety, and really just kind of feel out of control of their bodies. But also the brain, the ovaries affect the brain in terms of cognition, right? So being able to think clearly. So that brain fog, that feel like your brain is just failing you, the trouble with recall, you go to the grocery store and you can't remember, what you went in there for, kind of thing. It's very frustrating for a lot of women, and you're starting to think, gosh, am I experiencing early dementia? Like, what is going on? Why is my brain not functioning the capacity it once was? Then we start seeing some changes in our sleep, either the quality or the quantity of our sleep. And then we have physical symptoms like headaches and migraines. All of those are related to that gut ovarian axis. So with the understanding that these are common symptoms, right? But if the symptoms go undiagnosed and untreated, if you don't address the reason the body's saying, hey, help me, help me, help me, and we start to just shut it up with medication, then we start having a disease process actually set in. So these are the 4 most common conditions or diagnoses that we see among women that unfortunately are very disproportionate between men and women. So if you can see here, depression, women are twice as likely as men to experience depression. And unfortunately, 1 in 8 women are going to experience some aspect of depression at some point in their life. The reason why I've got more into understanding the gut ovarian axis was through my studies at Duke University. All doctorate candidates get to pick whatever they want to talk about, right? So we can research whatever, we can deep dive into something. I was seeing so many women, predominantly in the premenopausal, perimenopausal period, that were dealing with some pretty severe brain mood-related changes, right? So we saw things like severe PMDD, severe PMSs, and specifically with PMDD, these women are pretty debilitated, right? Like they're high risk for suicide. It's a 23% suicide rate. So through my understanding of what the heck is happening, how are the ovaries, the hormones affecting the brain, and specifically the mood, but depression is one of those things that what I was able to study. So women are more likely to attempt suicide. So obviously this is a big issue, and some of these changes actually are going to be worse through any menstrual changes for a female. So menarche, so the onset of menses, fertility, so going pregnancy and postpartum, those are big changes. And then, of course, the menopausal period. This is when you're going to see most of these symptoms start to onset. Alzheimer's disease, Alzheimer's is a type of cognitive decline, is a type of dementia. There's more out there, but specifically there are 4 million women in the U.S. that are affected by Alzheimer's disease, and right now it's about 20%. So we each have a 20% chance. That's pretty sad, of developing Alzheimer's disease, and it's the 6th leading cause of death among women. Significantly higher numbers than what we're seeing in male populations. Same thing for strokes. 60% of all strokes occur in women, 55,000 each year in the U.S., so significantly more than men, and it's the 3rd leading cause of death. MS is a autoimmune process that affects the brain. So you can have autoimmunity anywhere in the body. You can have it in the thyroid, and that could be Hashimoto's or Graves' disease. You can have it in the joints, that could be rheumatoid arthritis. You can have it in your connective tissue, that's more of a lupus type picture. But MS is the autoimmunity that affects the brain. So basically the body is attacking itself, essentially, and the brain tissue is unfortunately the area of target. Women are 2 to 3 times more likely to develop MS than men, and it does account for about 80% of all U.S. diseases in the autoimmune population. So women have about 80% of all the autoimmunity in the U.S. So what the heck is happening? Like, why are women having more strokes, more Alzheimer's, more autoimmunity that affects the brain, and more depression? It's hormones, right? Obviously, we can see that there's a huge connection here. So the traditional conventional treatment is a pill for every ill, right? It's you go into your doctor and say, hey, my brain's not good. I can't think very clearly anymore. Do I have Alzheimer's? Well, I don't know. Why don't you try this medication? Or when all else fails, let's just give you an antidepressant, because that's usually the biggest tool in their toolkit. Women complain of anything and they get an antidepressant, unfortunately. But medications just treat the symptoms. They're not treating the root causes. Then we end up with a lot of referrals. I see a lot of patients who come into me that they've already seen 3 or 4 other providers before the time they get to me. So all these specialists, they're kind of running out of ideas to do, so they're going to send you to another doctor. Hopefully they can uncover the root cause, or at least uncover what's going on. And then, of course, when all else fails, there's self-medication. We see a ton of this among women, and it's on the rise. Depression can lead to alcoholism. It can lead to potentially drug abuse, particularly among women, it's more prescription drugs. And then, of course, we can see other addiction-prone behaviors like, social media addictions, those kind of things. So functional medicine attempts to understand why, Why we look at the whole picture. Why are women developing Alzheimer's? Why are women developing these significantly more male? That requires like time with our clients, right? So we spend a lot of time with our client to uncover the root cause. We are the medicine of why, not the medicine of what. Our job is not just to diagnose and give a medication. Our job is to really uncover the root cause. So in the case of what we just talked about, these conditions are caused by hormone changes, and hormone imbalance. So estrogen is probably the main factor when you're talking about these neurodegenerative conditions. Estrogen is going to affect our mood, our cognition. It's got tons and tons of benefits. I think of estrogen as that little lady in the red dress, right? She's sassy. She's also got energy. She's like that the fun girl in the playground kind of thing. Testosterone is also very protective. It protects the heart, the brain. But it's building, right? So it's a strong one. It's helping to support the structural integrity of the brain, so the brain doesn't start to shrink. It actually helps improve blood flow to the heart and the brain as well, to kind of help support how you get blood flow and nutrients to these key organs. Testosterone is also that va-va-voom hormone, so it's a little sassy as well. It kind of gives you your mojo in life, and also helps with sexual appetite as well, which is really important for females. Progesterone's the calming one. So this is the fun one in the play blocks that's just, it's not super, super energizing. It's not super, super building, but it's going to calm you down, right? Like if we were all out there sassy lady in red dress, like we need to calm down at some point, right? We need to be able to rest. We need to be able to repair. We need to sleep. That's progesterone's job. So a lot of times through this perimenopausal period where you're like, I'm just so freaking irritable. I can't sleep. I just want to I feel like I've got anxiety all the time. It is most likely progesterone decline, which is the first hormone that starts to decline in our early 30s. So most of us think perimenopause is maybe 1 to 2 years. No, it's 10 to 15 years. So perimenopause can fluctuate predominantly with the progesterone. So any kind of hormonal imbalance is going to affect the way you feel, but it's also going to affect your cognition. So that energy with recall, that mental energy, that brain fog, all that's hormonal, but it also does other things as well. We know estrogen stops the hot flashes, right? Like we think about estrogen replacement therapy is only given for hot flash relief. That is not true. We give a lot of hormone replacement therapy to women who don't even have a single hot flash. That's just a symptom. We're really trying to be preventative. We do know that estrogen prevents your risk of things like Alzheimer's. It prevents your risk of things like bone loss, which actually carries a higher risk of death than breast cancer. So it's super, super important that we maintain our bone integrity through the perimenopausal period. And of course, it protects our brain as well. Testosterone helps support cognition, mental clarity, and that mental energy as well. So there's physical fatigue where you're just like, I don't want to get up out of bed this morning. And there's mental fatigue where sometimes you see this with office workers that have been on the computer all day long and just staring at that blue light for hours on end. You're just like, I don't want to do anything but just completely check out. Like I have the physical energy, but it's this wired but tired kind of feeling. And then, of course, the progesterone is the calming. It also balances out the progesterone and estrogen, testosterone and estrogen. So some of these are the factors. So again, we're going to talk about functional medicine. We're going to talk about the why. Why are these even happening? Why is there hormone imbalances in the body? So obviously things like issues with fertility and menopause. We do know that there's an age-related decline in our hormone production. That's fairly normal. However, we're not supposed to stop producing estrogen, progesterone, testosterone even after menopause, despite what you've been told. We need those hormones. And at the key point of our life is our postmenopausal time period. That's where we spend a third of our life. We can't go through that part of our life without our hormones. We absolutely need them. But the ovaries, where the predominantly producing gland for your estrogen, progesterone, testosterone, they're not working anymore. So something's got to kick in and do the job. It's supposed to be the adrenal glands. So the adrenal glands are these tiny little glands that sit above your kidneys on each side. They're super responsible for producing a lot of different hormones in the body. They produce cortisol, aldosterone, your mineralocorticoids. They basically keep you alive, right? So they help balance your blood sugar and your blood pressure. If you're so stinking stressed out for years and years and years of just life stressors, the adrenal glands are going to prioritize keeping you alive by producing cortisol first before they start producing your estrogen, progesterone, testosterone. So that's when we see this dramatic decline in women postmenopausally making any hormones at all. You should have some, but if you're not making any at all, it's because your adrenal glands are shot. That also goes back to the stress issue, right? So if we have a HPA axis disruption because we're so chronically stressed, that's going to affect the manufacture and utilization of these hormones. There are also conditions that affect directly the ovaries. So we see things like PCOS, severe endometriosis can cause ovarian failure. And then we have to think about outside the box, right? We're not just talking about the ovaries here, because the ovaries we just established talk to the adrenal glands, but the adrenal glands also talk to the thyroid. So if there's an issue with the thyroid gland, then it's going to affect your ovarian function as well. Other things are going to affect this process. So if your gut's not healthy, the gut, we just think about it's necessary for digestion of food. That is just one tiny little thing that it does. It has an overall goal to keep you young and healthy, right? So the gut actually helps support your manufacture of some certain hormones. It makes estrogen, it detox from estrogen. It makes testosterone, it detox from testosterone. And it also makes your neurotransmitters. So dopamine, that's that pleasure reward hormone, serotonin that kind of keeps you calm. 80% of those are made in the gut by certain bacteria. So if you don't have enough of that bacteria, if the gut's not healthy, especially going into menopause, you're not only going to see more mood disruption, but you're also potential for other things like weight gain and insulin insufficiency, so insulin sensitivity issues. Things like prediabetes happen after menopause because you don't have the healthy microbiome. Food sensitivities, any kind of things that you're eating, specifically a processed food, is going to trigger more inflammation. That inflammation blocks the receptor. So you may have a totally normal production of estrogen and progesterone. It might be an issue with the receptor. So hormones are kind of like the key that go in, and then you have the lock, which is the receptor. So these keys are specifically looking for certain locks that match them directly. And if they're blocked by inflammation, then that hormone will never get to that receptor site. So it may not be an issue of deficiency. And that's my point when we do lab testing and your labs are normal, right? You got to look at the whole picture. Your labs may truly be normal, but if they can't get to the receptor site because of inflammation, something's still broken. So we got to dive a little bit deeper to figure out what the root cause is. So obviously not having enough nutrients like omega-3 fatty acids, calcium, vitamin D, all these things work integratively into the body to help counteract inflammation as well. And then toxins. Toxins are huge. The average woman who leaves her house in the morning, before she leaves, she's exposed to about 150 different toxic chemicals. That's pretty intense, right? They're in our laundry detergent, they're in our personal care items, they're in everything. They're in our food supply, they're in our water supply. So a little bit of toxins is not going to kill us for the most part, right, that we're exposed to daily. But you can imagine 15, 30, 50, 60 years of these toxin exposure, they're eventually going to cause an issue. And then we also need to talk about the gut, right? So if we're going to talk about the ovaries, we need to talk about what's happening in the gut. Kind of like the things that affect the gut-brain axis or things that cause more inflammation. So again, food sensitivities, eating super processed food, and not having the right gut bacteria going into menopause are going to certainly affect the way our brain is functioning. So how can we improve gut health? Everyone needs to be aware of these things. Everyone, it doesn't matter if they're, a child up to, 50 years past menopause. We need to make sure that we're doing these things to improve our gut and health. The one thing you can do is decrease your intake of processed food. So processed food is anything that's not naturally found in the environment. It's something that has to be manufactured, typically in a laboratory. So there's minimally processed food and there's severely processed food, which is completely genetically modified. It's fake food. There's a lot of talk right now on Instagram about these ice cream sandwiches that don't melt, right? Have you guys heard about that? Like they're just leaving these ice cream sandwiches out in 90-degree weather for 2 or 3 days and they don't melt. Ice cream's supposed to melt, right? So that's not a real food. That's a fake food. That's a problem, right? So we need to be aware that these things are going to affect our body. Obviously, if it's not going to melt, then it's probably not going to digest anyway either, and it's going to disrupt the gut microbiome. So reducing your overall processed foods, eating more whole foods, fruits and vegetables, good quality protein sources, bean, lentils, nuts, and seeds, those are what you can do. And then you feed it. You feed the microbiome, which is the bacteria, through really good fiber intake, specifically for women. So things like cruciferous vegetables, broccoli, bok choy, cauliflower, those kind of things help support the microbiome. So that feeds our microbiome. Of course, we can always take supplements, probiotics. I do a ton of supplementation in my office because I believe in them, and it kind of just helps the gut heal faster. So those things are like L-glutamine and zinc, digestive enzymes, and then making sure you stay hydrated. If you dehydrate the gut, it's going to cause inflammation. So other things we can do to help balance our hormones is managing our stress, right? So stress for women is absolutely huge. It's a killer as far as like it's causing inflammation and it's causing a whole bunch of hormonal disruption. I tell people, this was part of my study when I was looking into the PMDD gut ovarian axis, is just moving our bodies in some capacity, right? So if we're staying stagnant all the time, just sitting on the couch and moving from the couch to the kitchen, that's the only exercise we get. We can assume that our bodies are not going to be healthy. And then find other ways to stress manage. I was really impressed to see all our vendors out there. There's a whole bunch of really cool things out there that you can do for stress management, right? So, the halotherapy salt cave, the float pool, massage therapy, facials, all these fun things. Pick one, right? Or do none of them and just do something on your own. So prayer, journaling, writing things down, reading your Bible, these kind of things just naturally reduce your stress levels. So just pick something that works for you and be consistent with that. It is something that you need to practice about 5 days a week based on the literature, 15 to 20 minutes, 5 days a week. So being intentional with that, eating a really good healthy diet. So I love like a Mediterranean-based food plan, which is really good omega-3 fatty acids from fish, seafood, nuts and seeds, really good quality olive oil, and it's very low in processed food and sugar as well. And then making sure you're getting sleep. How to reduce your toxic exposure. Again, if you have, you put on your favorite skincare thing and it's pretty toxic, if that's the only toxic thing you do in the day, you're probably going to be okay, right? But it's not. You're going to go drink, fountain water out of a plastic container, and you're going to get all those plastics in your system. So it's a combination of all these toxins that really are disrupting the issue. So try to be more aware of the things you're putting in your body and how your food is being prepared as well. So you get rid of plastics in your house. If nothing else, just don't microwave anything in plastic. So hot food in plastic is really, really detrimental to your endocrine system. These things are called forever chemicals for a reason, is that your body doesn't know what they are. They're man-made, and it doesn't know how to get rid of them. So they never leave the system. So just being aware of those things. And then, of course, obviously we're going to address everything we just talked about: gut health, proper nutrition, limiting processed foods, moving your body, managing your stress. But on occasion, we do involve some BHRT. We do know that estrogen replacement therapy reduces your risk of Alzheimer's disease by about 50%. That's pretty incredible. It is the gold standard to reduce your bone loss to prevent against osteoporosis. And we do know that it also protects the heart from heart disease as well. So we know that the reason why women have so much heart attacks is because of the estrogen loss postmenopausally. So estrogen actually protects the structural integrity of the brain and the heart, meaning all the wonderful blood vessels that carry oxygen to and away from the heart and nutrients. Without estrogen, they can get very stiff. So if you have stiff arteries, then it doesn't take much plaque at all to actually cause a blockage and cause a heart attack or stroke. Key takeaways, just as a recap: make sure you're sleeping 7 to 9 quality hours of sleep at night, moving your body most days of the week, managing your stress, eating good healthy foods, predominantly a Mediterranean food plan. I do think it's a good idea to supplement some of these things as well, just because I know the standard American diet is so deficient and void in micronutrients that we have to survive. So if I had to pick a few nutrients, it would be a really good probiotic, probably a fish oil for anti-inflammatory support and antioxidant support, and maybe some magnesium or zinc to kind of help the brain axis as well. Prioritizing gut health, eating whole foods, taking probiotics, getting fiber in, avoiding toxins when you can, and then if you're a really good candidate, you can consider hormone replacement therapy. So we've got time if anybody has any questions. I finished a little bit early. I know that a lot of that was over your head, and that's okay. The key takeaway, obviously, is the lifestyle stuff that we just talked about, right? So things that you can do absolutely most days of the week, if not daily, to lower your chance of getting these things. And that we do know that all this is studied and researched, that you can decrease your risk of Alzheimer's disease. Some people would even say you can reverse an active Alzheimer's onset with diet and lifestyle nutritional supplementation. If you want additional resources, I've got books. I can recommend a whole bunch of other things that we can do. If you feel like you want to maybe take advantage of some of our one-on-one functional medicine options, then come see our booth. Does anybody have any questions? I know it's a small crowd, so questions are sometimes a little awkward with small crowds, but you guys are welcome to ask me anything. There have been no studies, zero to my knowledge, that tell us when we need to stop BHRT. Now, if you ask a general practitioner, they kind of talk among themselves and they'll tell you 65. There has been no evidence of that whatsoever. I tell people, whenever you're ready to start aging, let's stop your hormones. That's my answer. I will take hormones for the rest of my life. I've been taking them for 6 years. I have 95-year-olds on hormones that have been taken for 20, 30 years, and they act, look, and feel like they're in their 50s. Like, hormones are the absolute best anti-aging thing you could do, along with a clean, healthy diet and lifestyle, right? My personal philosophy is that you don't want to put hormones in an inflamed, toxic environment. Anybody can write you a script for hormones. But if you do that and you don't address the other things we just talked about, number one, you're not going to get the best outcomes. But also, those hormones don't know how to get out, right? Like, there's inflammation in the gut, or they can't DB detox. You get a buildup of anything. It's not a good thing anymore. So it does need to be monitored. But yeah, that's my answer. Whenever you're ready to start aging, you can stop your hormones. Anything else? Yeah.
I recently retired and I worked a very busy 10-hour day, and now all I want to do is sleep. Is that a problem?
Well, I mean, I think your body is probably just resetting, right? Like, I mean, that's fairly normal. You kind of get in this habit of like constant go, go, go. And then when you stop using your resources anymore, like the brain's a muscle. And the rest of your muscles, like actually physically moving your body, it starts to shrink. It starts to die down. Like, the brain starts to shrink in size, the muscles start to shrink in size. So there's a reason why we say the body in action stays in action. That includes the mind as well. So you have to be very intentional. You have to be very intentional to get yourself out of the morning, getting ready for the day, putting your clothes on, getting ready, go exercise, spend social time with friends and family. That's so important as well. Like, this whole community, living in community, is essential for overall health and wellness. Making sure you're, prepping your meals. All this is habits, right? So right now you're kind of out of your habits, and your body just like, oh, well, if I don't have anything to do, then I'm just going to rest. When we do that, then our body starts breaking down. So being intentional as much as you can. That's challenging too. I see a lot of people that go through that retirement period. It's like they just burn themselves out for this many years, and then they finally get a chance to rest, and that's all that they do. That's not great. I actually have the lady that spoke in front of me, her name is Catherine Lundberg. She's a life coach. She actually does some contract work for us and with our clients to help them through those seasons, to help them figure out a why, right? Like, your why to going to work every day was financial stability, and probably at this point in your life, you've already planned all that, right? You don't need the money anymore. You've got savings. You don't have to go to work for any specific reason other than they made you go. You don't have a why. Potentially, I may just be skipping the gun here, but having your why and understanding what my purpose is, even after retirement, even after menopause, I think that's really important. So yeah, whatever you can do to kind of form this habit and kind of stay active. But your body will continue to degrade if you don't counteract that. Do you have a question? A brain surgery? Okay. Yeah, absolutely. I have been able to get people out of surgeries if it's a true functional issue. Right now, if there's a structural issue there's a massive absolute tumor that's not going to shrink down. Functional medicine's never going to be able to fix that. We do a lot better job being preventative, right? So coming in early, assessing things early to make sure that there's nothing going imbalanced. Would love to sidebar with you and kind of give you some advice on that. But if your body's telling you not quite ready for the surgery, there might be some other things that you can do to intervene to potentially delay it, or depending on what's going on. But yeah, if nothing else, have a plan after surgery, right? They take your ovaries out, something's going to produce those hormones, right? Yeah. All right, ladies, thanks for coming. Appreciate it. If you have any additional questions, I'll be at the booth for another 30 minutes or so.